Afternoon, everybody. It looks like it's 1 o'clock, so we will get started. I want to thank all of you for joining another Superior Health Quality Alliance Roundtable conversation. My name's Kim Heft. I'm joined by my colleague, Janae, as well as our guest speaker today, Sally Pung. We host these 1-hour sessions on the second and the fourth Wednesday of the month. The first half of the presentation is didactic, and then the remaining time will be for question and answer. Now, besides learning from our speakers, I want to thank you, our participants, for helping your fellow nursing home leaders on this call. We've had many calls in the past where you've shared resources and strategies, and we appreciate you, and we really encourage you to continue supporting each other. Now, one thing I'd like to ask is that if you can think of things that might be troubling you, that you're struggling with trying to figure out, we may be able to use that as a topic in a future roundtable event. You could put that in chat. You can just put that suggestion straight to me in a Zoom chat, or you could put that in the survey that we provide at the end of the session. You could put your suggestion in there too. We're going to put the link for the PowerPoint presentation in chat just momentarily. And I'd also encourage you to use that chat box to share any comments, questions, anything that pops into your mind during the presentation. And then we're going to use that for discussion in our Q&A. Now, before we get started today with our presentation, Janae, she's a QIA for Superior Health. She's going to give us an update, a review. She's going to give us a review on the QSO 2310 nursing home memo that came out on March 30th of this year. And it's about revisions made to infection control regarding citations. So Janae, what do you have for us today?
Thanks, Kim. So yeah, these revisions were released on March 30th of 2023. They are heavily focused on infection control deficiencies that result in actual harm or immediate jeopardy of a resident. These revisions have also been expanded to include infection control deficiencies that result in no resident harm when deficiencies cited include tag numbers F880 and F877. Now, under tag number F877, nursing homes are required to educate residents and staff on COVID-19 vaccinations, and facilities must offer the vaccine when supplies are readily available. The arrangement can be made directly at the facility or indirectly through another outside source. It's also important for facilities to provide staff and residents with information on how to access COVID-19 vaccinations. And when non-compliance regarding tag numbers F80 and F877 are cited, facilities must include in their plan of correction a root cause analysis, and facilities must work with a quality improvement organization or another qualified consultant. So just as a friendly reminder, here at Superior Health, we are your state's QIO, and we encourage you to please reach out to any Superior Health staff member that is on the call today to learn more about the assistance that we're able to provide you with surrounding vaccines and infection control. And so with that, I will turn it over to Sally, but I will make sure that I will drop that QSO memo here on the chat.
Perfect. And Sally, before you begin, also, if anyone has any questions about this memo that you would like us to answer, Janae and I will help go through those if you have any. And we'll do that at the end of the presentation. So think about that right now. And again, we'll put that memo into chat. So today, Sally Pung, she is the state long-term care ombudsman for the state of Michigan, and she's going to be presenting on abuse prevention, simple approaches. So welcome, Sally. We're really glad to have you here today. The floor is yours. So go ahead, share your screen, and we'll get started.
Great. Thank you so much, Kim. Can you see my slides okay?
Looks wonderful.
Great. So good afternoon, everyone. The Michigan Long-Term Care Ombudsman Program developed an abuse prevention training for long-term care providers. And generally, it's delivered in person in multiple sessions, so staff from all shifts and departments, including the management staff, can attend the training. I'm happy to be with you here today to share a very small portion of the abuse prevention training with you. In some of our sections that we're going to go over today, there would be a group activity or a group discussion, but I've admitted those due to our limited time together. Before I start, I wanted to share with you that this came about. We approached a nursing home here in Michigan that we noticed was having significant citations on abuse related issues over like an 18-month period. And we just saw that that home needed a little help. And we met with them, we talked about doing this type of a training with them. And following the training, that provider set up a task force within their home. And I have to say, after a short time, we saw an incredible change, a reduction, if not elimination, of abuse citations, and a real change in the culture. I happened to visit that home, and when you walk in the door, any staff member that's nearby, ask if you can have what they can help you with. You got a nice greeting. And I noticed that call lights weren't being used very much in this home because staff were very attentive to the residents. And I just think it really demonstrated how staff got to know each other, came together as a team, and really changed the culture in that nursing home. So although today's tidbits are going to seem very simple to most of us, I think now is the time that these simple solutions can be helpful in us kind of getting back to that culture that we were at before the pandemic, and helping reduce the stress that we're all experiencing. So let's get started. Oops. And for some reason, my slides aren't advancing. So let me stop sharing for a moment and try that again. I apologize. Hitting the button 4 times didn't seem to work. Oh dear.
Well, for some reason, if you cannot get your slides to advance, we can switch this out.
I resolved it, so I apologize for that. So again, I'm
Okay.
Sally Fung, the State Long-Term Care Ombudsman here in Michigan. So today we want to talk about how to use person-centered care and relationships as a tool for abuse prevention, how to identify stressors and ways to manage them, and how we can use effective communication strategies and de-escalation techniques. And again, these were really developed for all staff members, not just management. And a few of them are even helpful for residents. So to begin, let's start by reviewing how we view residents in a nursing home. We used to use an institutional model, which tends to focus on residents' limitations. It doesn't always view them as a whole person with a history, and it often uses labels or language that can be derogatory. But the goal should be a person-centered model, which focuses on what residents can do. It views residents as unique individuals with full life experiences, and it understands residents have preferences and they want to make their own choices. So the more we think of residents as people and not diagnosis, tasks, or behaviors, the less likely we are to be unkind, unthinking, even abuseful or neglectful. And now let's think about how you perceive or describe someone using medical versus or institutional language rather than person-centered language. So as we compare perspectives, think about what language you would prefer. The words we use really do matter. So for example, rather than using the term elderly, try saying older adults or an older person. And rather than stating a resident is demented, refer to that person as someone living with dementia. Instead of using the term diapers, why not refer to them as briefs or underwear, which they really are? And referring to or labeling someone by their behaviors is less respectful than stating that they are reacting to something or expressing a need. And rather than stating that a resident is not their own person, refer to him as her as someone who needs assistance with decisions. These are just a few of the numerous examples of how using person-centered language has a long-lasting positive impact on your interactions with residents and other older adults in your life. So person-centered care is resident-focused and relationship-based. It's about seeing each person as a unique individual, respecting each resident's skills and abilities, supporting them to be successful and maintain independence, helping them meet their needs for attachment and inclusion, occupation, and comfort. And it is welcoming to each resident as a member of your community. So when we think about caregivers, let's think for a minute about what kind of caregiver would you want? What would be important about them? Like attributes like being kind, knowledgeable, maybe funny, polite, compassionate, or patient. We assume that people know how to do their job. For example, how to make beds, serve food, draw blood, or assist with ADLs. It is all the other characteristics that are important and make all the difference. These are the characteristics that are also important to your residents. The residents know you can do your job, but they also need understanding, patience, respect, and being treated with dignity. So let's think of entering the nursing home as a new resident. What are some of the relationships you would lose when you live in the nursing home? Think about people you may talk to or rely on regularly, like family members, friends, your mail carrier, church members, the Meals on Wheels delivery person, your hairstylist or barber, the person at your grocery store that you talk with, your neighbors, or even your pets. When people lose their outside relationships, they search for new connections and relationships. So where do you think residents look for these? They find all of you. It's important for staff to understand the losses experienced by your residents and the deep need they still have to belong. Research shows that feeling isolated or lonely is a bigger factor of premature death than smoking. That's amazing. It's a bigger indicator of premature death than smoking. Additionally, residents still need to feel useful, to be active and independent to the extent that's possible. Think of some ways you can make residents feel all of these things. If you figure out what matters to the resident, then you can figure out what is the matter with him or her. When you really know your residents, who is important in their lives, what kind of routine they had, their hobbies, likes and dislikes, what they did for a living, then when something is wrong or when they have an unmet need, it is much easier to figure out what they need, knowing what really matters. So now let's talk about prevention and stress triggers. So why should we identify stress triggers? We know it's important to recognize them when you or someone else's stress is at an unhealthy level, to prevent someone from doing something abusive, neglectful, or just unkind, or to help identify appropriate stress management techniques. One of the goals of this training is for each of us to recognize when we are stressed and to give ourselves time before reacting. Immediate reactions or instincts can end up being abusive or neglectful, even when it's not intended. So any of us have the potential to be abusive or neglectful given the right set of circumstances. It's important not to only know yourself and your residents, but try to get to know your coworkers and how they react to stress. This is one way to prevent abuse or neglect from occurring. Think about how you personally respond to stress physically, emotionally, mentally, socially, and or on the job. There's so much to deal with. So let's discuss the major three categories of stress. So there's life influences, job challenges, and sometimes resident reactions. So we'll discuss each of these triggers in more detail. So let's think about life influences. We'll take a look at two different categories when it comes to stress in your life: your background and your life today. So for your background, you have learned behaviors like your habits, how you were raised, experiences growing up, what your family was like, communication styles. Did you live in an environment where you yelled to communicate, or you didn't express emotions, or you withdrew from conflict? Think about cultural and family traditions, family characteristics and norms and values, and even trauma you may have experienced, like a history of abuse or a death of a family member. Those all play into your background of your life influences. And then let's switch and think about your life today. So home circumstances. So are you coming to work when someone is at home sick, or you've had a family conflict, or maybe your parents are divorcing, or current events in the world, in our nation, or in our communities? Watching the media can be really stressful. Everyday pressures and expectations. So your home or car repairs, caregiving for a family member, financial constraints, childcare. Think about your support system or the lack of it. Are you out there feeling like you're doing it all alone? And even trauma as an adult, like major life changes, or again, mourning the loss of a loved one. Our life influences have a tremendous impact on each of us that can be challenging and stressful. They can play a big role in how we treat others. When we are proactive in addressing these issues, it can help us handle stresses more successfully. Sometimes we don't even realize these things are influencing us. So let's talk now about job challenges. And definitely they've been at the highest level possible during this pandemic. So think about the physical plant, the actual building or the environment, and that stresses can produce, like the temperature of the building, the lack of storage, the smells or sounds in the environment, lack of privacy, alarms going off, covering a lot of ground in a day, or how about even having to wear a mask all day? Those can add to our stress. How about lack of training and preparation when you first starting your job, or with serving a diverse population in nursing homes? Think about younger residents, people with traumatic brain injuries, people living with dementia or complex physical needs. Long-term care has definitely evolved and changed over the last few years. Think of physical demands of the job, mandatory overtime, not enough time to complete the task and serve residents the way you'd like. Staff shortages. It's even more of a problem since the pandemic. And think about public opinion and inspections. Think about what it's like for your staff to hear the bad press about nursing homes, especially during and since the pandemic. How they feel during surveys or complaint investigations. This can be a significant source of stress. And family members and their expectations. How it feels when their expectations are unrealistic or when they lack respect or start conflicts. As ombudsman, we're hearing more and more situations in which family conflict is adding stress, not only to staff, but to residents and others in the nursing home. So what about when families' wishes conflict with what the resident wants? It's hard sometimes to be put in the middle. Relationship issues with coworkers. What about staff who aren't carrying their weight, or they always arrive late, or they have a negative attitude? That can be a stressor for us. Relationship issues with supervisors. It isn't always the pay that makes someone leave their job. It may be their relationship with their supervisor. Like maybe they feel there's a lack of respect, or they don't feel listened to or valued. Maybe they feel like there's favoritism. And let's talk about burnout. Your jobs are difficult and demanding, and it can be difficult to know how to manage the stress and not take it home with you. Healthcare workers are susceptible to burnout, which can occur when you've reached a state of mental and physical exhaustion because of your workload. And secondary trauma can be described as the cost of caring for others. Sometimes we can experience trauma through caring for our residents who are experiencing trauma. We don't always recognize that as a stressor. Here's my favorite slide. Coworker stress. So how might you identify when a coworker is stressed out? Are they being abrupt with others or argumentative? Do they have a why bother attitude? Are they avoiding tough situations? Are they doing or saying hurtful things? Especially when these things are all out of character for that person. It's important to know one another and recognize when a coworker needs help coping with triggers. Being able to support one another on the job is one of the best ways to prevent abuse and neglect. And let's talk about resident reactions, sometimes called behaviors. So what are the things that residents do which bother, confuse, or hurt you? Often these things get written down in charts or care plans as behaviors, when in fact it is often a resident's attempt to trying to communicate and/or is a reaction to something. Maybe the resident just has a need that's unmet and they're trying to communicate that to you. The word behavior has a negative connotation, and as discussed earlier, once someone has been labeled, it's more difficult to see them as a person. So try to think of behaviors as a communication. Try to think of behavior as someone trying to communicate a need or a reaction to something. It really does help reduce your stress level when you have that approach to a resident's communication with you. So this slide is another important reminder of why person-centeredness is critical in caring for your residents. So why understand the reasons for resident reactions? Well, your knowledge and your relationship with the residents can help improve your ability to provide care. You can help identify signs of illness earlier on. Maybe you've noticed a change in the resident and then you realize there's a UTI or a fever or something else that's happened. It can reduce resident to resident misunderstandings. And as ombudsman, we're seeing a lot more stress and irritation between residents, more than we've ever noticed before. And it can promote positive interactions. Most importantly, promote positive interactions if we understand why residents are reacting. So let's just take a minute to be proactive by talking about the following steps to make your job and life less stressful. So try to keep a positive outlook. You have to really make a point of trying to be as positive as possible. Know your stressors and avoid or minimize the ones that you can. Have something to look forward to every day. We all need joy in our life to recover from the stress that we experience in our jobs. Ask for help when needed. There's nothing wrong with asking someone to help you. And keep things in perspective. Oftentimes we react so quickly we make mountains out of molehills. So trying to keep things in perspective can really help you reduce your stress. So here are some quick tips on how to calm if you find yourself in a stressful situation. So take a moment and de-escalate with these quick tips. Just take a couple of deep breaths. It's amazing how that can help. It can distract you and it can calm you down. Take a time out. Step away from the situation for a moment if you need to, or just slow down. We know that staff are working so hard to get all of those tasks completed. And if you have an opportunity, maybe just slow down and cut yourself a little bit of a break. Or try to just shake it off, physically shake it off and try to move on. Or reward yourself. Say, I'm going to have a little piece of chocolate because I handled that really well. Or just talk to someone else. It's okay to say I'm a little stressed or here's how I felt about that. Talk about it and get it out. Sometimes that's a great way to help calm down. So you really have to use proper self-care to help manage stress. Proper self-care is critical to effectively managing our stress. Have you ever noticed that when your own needs are being met, you are much more able to handle problems that come your way? Some useful self-care strategies include making sure your physical and emotional needs are being met. Sometimes taking that short 5-minute walk every morning or in the evening really can help you be in a better situation and reduce your stress. Saying no to requests that aren't right for you. That's really hard for a lot of us to say no. And sometimes we just have to force ourselves to do it, although that might trigger some more stress for us. Finding time to do what brings you joy. They don't have to be big things. What brings you joy? Having a nurturing daily routine. Same thing. Just, take care of yourself, whether it's that 5 minutes in the morning or at bedtime. Make sure you're doing something that is a good routine that nurtures yourself. And avoid negative coping skills. And I'm guilty of these, like eating, especially chocolate, or drinking in excess, or other things that might not be healthy for you. Try to avoid those and keep them in check. Encourage and give permission to provide good self-care. So when your own cup is full, you're much better to meet not only your needs, but the needs of others. And just remember that self-care isn't selfish. So remind yourselves of that. Tell yourself self-care isn't selfish. And another tip for stress management, don't forget humor. There's so many great benefits to humor. They can help relieve stressful situations, not the least of which is an improvement in overall health and well-being. When you can find joy and laughter in life's disappointments, it can make challenging tasks feel less stressful. Humor can be very effective as a coping mechanism for tense moments or conversations. And when used appropriately, humor can de-escalate stressful situations, and during conflict can help break tensions. Humor and laughter increase energy by reducing stress. Humor is truly one of the most effective ways to communicate and reduce stress. Now let's examine ways to counteract the triggers and de-escalation situations with coworkers and residents. So de-escalation is how we intervene in situations where one or more people have been triggered and the situation could immediately become abusive or neglectful, or has already reached that point. De-escalation techniques help us deal with difficult situations in the workplace. The best abuse prevention is to recognize our stress triggers and signals and resolve them before they escalate. Here's some ways we can respond constructively when dealing with a stressful situation. So we can use active listening and paraphrasing. So that's when we put our phone down and we make eye contact and we actively listen to the situation. And then we repeat back or we paraphrase back what we thought we heard. That being listened to really can be a de-escalation technique. Always pause before responding. Take those few deep breaths. Think about what your response will be. Or again, step away from the moment if needed. If you're feeling like you're escalated, just take a break from it for a minute. You can just say, I need a minute. I'll be right back. It's fine to do that. Don't jump to conclusions or be defensive or blame others. Just listen and then look for solutions and look for common ground. That's a great way to de-escalate. You might be able to agree that with someone, I would be upset too if that happened to me. And then look for ways in which you can help move forward. So when we think of other de-escalation techniques, respond constructively. Use I statements rather than you statements. So using the word you in a disagreement is the same as blaming that person, and he or she is likely to become defensive. So practice using I statements. Think before speaking. I think we've said this a few times now. How many of us have said something without thinking that we wish we could take back? Just take that pause and think before we respond. Handle difficult conversations in person. Emotions are often taken out of context in text messages and emails. It is much more effective to speak directly to someone. In person is always best when there are a lot of emotions involved or when it is an intense topic. In person always seems to work best. And avoid using the word but in praising someone or apologizing. It negates what you have said. So for example, I'm sorry, but you always. The sorry is gone. The person won't hear that any longer. So also work to negotiate and compromise when it's appropriate. We can always give a little to try to help resolve the situation and de-escalate the issue. So I wanted to share with you a couple of techniques for de-escalating a resident, because oftentimes the stress is with the resident or the resident is stressful and that stresses staff. So, I think we all know validation therapy may work for some residents who are living with a brain change, either living with dementia or traumatic brain injury. So validating how they feel and using a distraction to redirect the resident can oftentimes help de-escalate a resident. But what about residents who are escalating out of frustration? First tell that resident that you are sorry that they are having this experience. Show them empathy. You can say, I would feel that way as well, or I'm sorry this is happening to you. You're not agreeing, you're just giving them empathy. Be sure to and ask, what can we do to solve this problem? Maybe the resident has a solution and maybe it's a simple one. Be sure to follow up with the resident to ensure that the issue has been resolved to their satisfaction. This goes a really long way in building a trusting relationship. So I just wanted to mention that a lot of disagreements happen because both people feel they need to be in control of the situation. Residents often feel like they need to ask permission or assistance with almost everything, like using the bathroom, going to lunch, going outdoors. So of course, residents will look for ways to feel productive or in control. So we always tell staff to remember, you have the choice in that you can walk out of the room and even leave the building whenever you want. Many of the residents cannot. Even if a resident is swearing at you or even hitting you, it is your responsibility to try to understand why the resident is communicating this way. You have control and the resident doesn't always. So on my last slide, I just wanted to boil it down to 5 simple steps that we can use to prevent abuse and neglect. The first one is to make sure that we're taking care of ourselves. Knowing that the individual needs of your residents that you're caring for, knowing what your own stressors are, doing your best to manage stress, and then asking for help or offering help to others when I notice signs of stress. These will go really far. They're simple. And I hope that after today's session, some of you will be able to take those things back and use them with your staff. They are very simple. And I think if I just have a minute or two, I just wanted to offer that anyone that would like to see more of this training, or if you're in Michigan and you'd like it conducted in your home, we'd be happy, to make that available. We do have a train the trainer session available that we could offer for our out-of-state providers. And it goes into much more detail. It is a 3-hour training. And then we could even share with you how we developed our task force in those homes and how they took it into even further activities to change the culture. So with that, I've left my email address here for you today. And again, thank you for giving me the time today to share a bit with you about how we approach reducing stress and abuse prevention.
Oh, thanks, Sally. Sally, yeah, you took as I'm listening to this, there's so many things that could be elaborated on more. And like you had said, you're just, high level skimming the bucket here at the top. And yeah, I'm glad that you also added that you're right. You have a train the trainer session and for outs of the state also, so that they could implement this. And then you mentioned about more information, how to implement that task force. Could you possibly give us some high level points on how that works? I have leadership here, that nursing home leaders that are probably like, oh, this is a great presentation. I'm going to present it to my staff, but how do I get this culture to change? And what does that look like? What are some effective strategies?
Sure. So Kim, let me share with you what we did here in Michigan. And I have to give all this credit to Carrie Craig. She's on the call today. She's my assistant state long-term care ombudsman. And she really polished this training off. And she developed that first, nursing home task force within the one setting. But one thing I wanted to add is that we also hold a session to meet with residents, to talk with residents and about what we've trained about stressors and what we've trained about how staff might respond, so that if a staff member says this, it's because they're being, trained that way. So we wanted to make sure that residents were involved. And for the task force, we asked for volunteers within the home from all levels of staff. There had to be nurse aides involved. We wanted someone from dietary, housekeeping, and the leader of the task force did not have to be the administrator. We really wanted these to be individuals that were wanted to be change agents, if you will, in the home. They all have task force t-shirts that they get to wear on particular days. In the one home that was very successful with their task force, they met, I believe, weekly. They chose what things they wanted to address, and they just took each step very slowly. I remember they had one meeting where they talked about care planning, and Carrie took a care plan that she had written for herself to show them what a meaningful care plan could look like. So I think it can go where the home needs it to go when you develop this task force, and it's really getting all staff involved, or at least a number of staff from different areas, to get feedback from them about how can we improve the way we operate here? How can we change the culture? How can we work as a stronger team to create that environment that is attractive to not only staff, but our residents? And I think that's what made it so successful, was that we let the facility own that task force, and we just offered facilitation and resources to them when they brought up different topics that they wanted to address and work on.
Yeah, that's really insightful. I like that. Oh, and by the way, anybody that has any questions for Sally, please feel free to unmute yourself or put a question into chat at any time that we're talking here. She's here to answer your questions. Remember, you're talking to your long-term care ombudsman, so now's a good chance to really ask her anything that might be pertinent to her line of expertise. So I encourage you to do that.
Kim, if I could share part of
Yes,
the training, which I didn't include for this purpose, but we do spend quite a bit of time in that training talking about mandated reporters and reporting requirements under the federal nursing home regulations, what that might look like in your home, because we know that some homes have different processes or different individuals that you report to, but we really wanted to make sure that staff members understood that they were mandated reporters. And we also went over the reporting requirements under the Elder Justice Act, which requires reporting of particular crimes. And again, talking with, not dictating how you would do that, but to talk to your facility leadership about what that process looks like. We spent the training also includes a section about identifying abuse, because oftentimes abuse isn't an open a significant bruise or a bleeding wound. Abuse can sometimes look different, and oftentimes it's more the subtle abuse, like verbal abuse, the way that we talk to individuals. And so we have a whole section in that training about identifying different types of abuse and how to report that. And again, that's something we train residents on. Today I just really tried to look at the stressors and how to reduce those, but the training in 3 hours it's very, very interactive. There's a lot of activities for the staff to be engaged in, because 3 hours is a really long time for staff members who are used to being on their feet to participate in a training. So it is very interactive.
Is this training, does it have to be done in 3 hours? I think about nursing home time and, strategizing on how to get staff to participate in the 3 hour stint, and that we don't already have enough staff. Have you found any other ways to break that down?
Kim, I think it can be, most of our training we had done before the pandemic, and it was a bit of the stretch.
Yeah.
What we did was our trainer would be on site for a whole day. So they'd go early in the morning, train, at shift change, be there in the evening, and then return the next day, so that staff that worked different shifts obviously could have the opportunity to participate when it worked best for their schedule. So we offered 4 and sometimes even 5 training sessions for the facility, just to accommodate all the staff schedules. But we are changing the way that we're looking at that. We haven't landed quite yet on what that could look like, but I think for others, they could easily break that down into 1 hour segments. What we think is really valuable in this training is the interaction by bringing the group together and having them sit in a room and learn about each other. There were staff members who hadn't met each other before, and it was the first opportunity, staff from different departments or different shifts that didn't know each other, and to come together and see how much you have in common with those, and that you have a full team of people just like you trying to do the same job and get the same task accomplished with the same goals. I think that's really helpful for team building. So we haven't found a way to do it remotely, because we think you lose that team building experience. So I think there are always ways that you can be creative and try to break that down into segments that work better, because we know it is really challenging right now to do in-person training.
Oh, for sure. So far, I don't see any questions. Again, please feel free to ask Sally about anything you'd like. And Sally, Mykesha looks like she has a question Mikey, should you just want to unmute yourself and
Yeah,
go ahead?
yes. So I really appreciate the training, and it's very helpful to make sure that our staff are in those settings are taking care of themselves, and they also know that it's okay to take a break and take a step back. When I was in those facilities, and this might be a question for a lot of individuals on this call, is when you have just family and so forth, or you have a resident that can be very challenging, which is just from a lack of better terminology, can be challenging to meet some of the requests that they have. And despite the facility working towards it, they're working towards things that they may be concerned about and so forth. And even with the resolution, sometimes it doesn't feel like you're meeting in the middle to come up with a resolution with a family, where sometimes family or the resident may be continue to be combative. How do you work through that so that your staff don't feel hesitant to work with a family, or don't feel hesitant to try to improve the quality and keep that customer service at a focus? If that makes sense.
Yeah, Keisha, I think I caught most of that. I'm sorry, it was difficult to hear on my end, but it sounded like you were asking for tips on how to work with residents or their families when they seem to not be satisfied. Did I?
Absolutely. I'm sorry. Sometimes I'm on a Zoom call. My volume is not working very well, so I have to lean all the way in. So I'm leaned in now. So with that being said, it's just when it's challenging, and sometimes your staff may be hesitant to work with those individuals, just because every time they do interact and so forth, there's something wrong, if that makes sense. And so being able to work with those families and being able to support the staff, but also making sure that the residents' needs are met. How do you suggest to mitigate some of the things that happen in those conversations? Obviously, you know, administrators, DONs, and the staff are working towards and documenting everything and showing that they have been trying to work with the families. But sometimes it can be very challenging on a day-to-day basis.
So yes, I would say, Sally, yeah, the challenges with the staff being hesitant to actually maybe even care for a resident because of the worry of some form of a family input and what that might that look like. So yes, conflicts between families and staff.
Oh, that is a challenge. And I have to say, I think we're seeing more and more of that. I think it's just a sign of the frustration and stress that people are under right now. But to answer your question, I think what we've found when we've had those situations where staff are hesitant, as ombudsman, we usually try to clarify with the resident, you know, what are the concerns and what is it that we can help you change? So I don't want to bombard your ombudsman in other states, but an ombudsman might be helpful as a neutral party to kind of help the resident prioritize what are the things that are most important to you and how can we work with the staff to have those needs met. Another thing that we've done is we've tried to find that one staff person in the facility that can work successfully with the resident and try to have them kind of mentor the other staff, you know, and by saying maybe to the resident, you know, I'm here today because I want to show, you know, so-and-so the way that you like to have this done for you, you know, and kind of mentor them and show the resident that we hear you, we understand that you have specific needs, but we're trying to get other staff to feel more comfortable in providing your care and doing it the way that you'd like. I know that's my response is very much from an ombudsman perspective, but I think just listening and, you know, talking with that resident, you know, the families I think get more challenging, and I think just saying to families, you know, I hear your concerns. We understand. We have the same goals that you do. Here are the, you know, limitations that we have. Here's when this happens, this is the outcome of that. How can we try to help create a better environment where, you know, more of our staff can deliver care and you can feel more confident in the care. I think it does just get down to opening up communication and having all the parties at the table at once. I think sometimes that's helpful. And I don't think there's any one answer that works for every situation. I think you just have to try different things. I hope that's helpful. Those are some of the things that we've tried in the past. Oh, I see in your chat.
Yep.
Yeah, I'm glad to hear that that might be helpful. You know, and again, we look at it from the resident perspective, but oftentimes if we really understand what the resident is complaining about, sometimes it's something totally different than what we see on the surface. Sometimes it's something much simpler than that, or a different frustration that they're having. So I think communication and then supporting the staff and those mentoring opportunities we've found have worked really well. Great question.
Yeah, as you were talking, Sally, the first thing I could think of in my past experiences was when we had issues with, it didn't matter if it was with a resident, with family, with staff to staff, a lot of it boiled down to the communication. It was communication. As soon as we all got together and really discussed what was happening, it wasn't one-sided, as it wasn't what we thought that person felt or what have you. It was literally having the communication, and that's what actually ended up solving our issues and moving forward.
And I think, Kim, it's also important for leaders in the building to, you know, arm, if you will, your staff members with the ability and kind of the challenge to have that open communication. I don't think you have to go back to the DON or the administrator every time to resolve those issues. Maybe you can work with the nurse on the unit, you know, kind of empowering your staff to be able to have those communications within some parameters, of course. But, you know, oh, you want to change your day that you have a shower? Well, you know, maybe I can get with this person and we can, you know, hopefully those things don't have to be a larger sit down meeting. Hopefully you can just do it with a few people involved, and empower your staff to be able to have those discussions and then make sure they're reporting back to the resident. Here's what I did. Or if they can't resolve it, make sure you're reporting back and having someone follow up so that the resident knows your concern was heard and it's being addressed. I think those things go really far as well.
So Sally, if there's one thing, or if there's a couple things that, you know, let's just say, okay, this training actually for the task force sounds excellent, but let's just say, you know what, I'm not ready to do that yet. It's just not where I am right now with the situation in my home. I mean, it's going to be soon, but in the meantime, are there any suggestions to that you would say off the top of your head was like, at the very least, maybe implement or try these strategies just to get maybe a high level start at promoting a different culture of positivity, which in turn will turn into lack of abuse situations?
Sure. So, you know, Kim, one of the first things that I think of, and I do it when I'm out as an ombudsman in nursing homes, if I'm out visiting, and I think a lot of our local ombudsmen do it. We thank the staff for being there. You know, we're showing value in this. We just say, you know, thank you for coming to work. Thank you for being here, because we know how difficult it's been. You know, I think that goes a long way if someone feels valued and they're recognized that they're part of the team. And you know, that sounds like such a simple thing, but you know, smiling at someone, calling them by name, and just simply saying thank you for being here today, and then maybe going on to say, do you have any concerns? Is there anything you need? Because I think making yourselves available to the staff, now we know you might get a little overwhelmed initially, but I think that goes so far when staff feel like they're being valued. And I think in turn, they return that kindness to the residents. You've set that example as a leader that I'm going to treat my employees with, you know, respect, and that they're valued and that I appreciate them. And I think it's very easy then for staff to carry that forward to the residents. I think that's one of the, you know, cheapest things that you can do. Now, it means that you're out of your office and you're kind of doing rounds, and it may mean that you hear a lot of concerns coming back to you or a lot of needs, but isn't that the better way to learn about what the needs are of your staff and residents than to have a surveyor tell you that later on? You know, I think it goes far to improving the care in the home and creating that culture where communication should be open and that you're valued and respected as part of, you know, the whole community, residents, staff, and visitors. So I think, I know that's really Pollyanna and an easy thing to do, but I think that goes so far. It helps with retention, and hopefully you can build that culture in your home where it's where people want to work, and that might help with recruitment.
Yeah, very good point. Very good point, Sally. Sally, tell us again, for those that are interested in of the 3-hour training and developing a task force, where would they get this information again?
Oh, if you want, you can email me. My email is spung@meji.org. Just reach out to me. I can connect you with Carrie, and we can figure out a way to set up a, it would have to be a remote train the trainer. If you're out of state, but I think we'd love to be able to share our training and make it available. Again, it's simple. It's intended to be easy for staff to participate in, and to really bring about that change in communication and team building. And then the benefit, of course, is that you're reducing stress and preventing abuse. So just email. I think email is the best way to reach out to us, and we can have a discussion about how to move forward with that.
Excellent. Perfect. That sounds like a great plan. Do we have any other questions for Sally? Janae, if you haven't, could you drop the survey in? Yep, perfect. She did. Excellent. Everyone, you're going to see that there is a survey for today's presentation. We would really appreciate it if you would complete that. Again, if you do have an opinion for a future topic, you could put that here in this survey also. I want to thank Sally for being here today. This has been a great presentation, and I'm really excited about the work that you're doing with this task force. I think it can change the lives of nursing home residents and staff. And also, I want to remind everyone that our next event, which is on May 10th, that will be on falls and fall prevention. So I do hope to see all of you there for the May 10th session. And I'm stalling a little bit just in case there was anyone else that wanted to ask a question or put anything in chat, but I don't see it. So on that note, thank you again, Sally, and thank you everyone for being here. We will see you in a couple weeks. Take care, everyone. Bye-bye.